care credit cards have been around for a long time. The only difference is now that the hospitals are pushing them more, and hospitals, almost all of them, if not all of them, can finance your bill. So they'll put you on a payment plan. But whenever they do that, the bill is still with them. So you have power still to be able to negotiate the bill. But once you put that bill on a credit card, your account is closed, the bill is paid off, and hospitals are way less open to negotiating your bill if it was charged incorrectly.
Okay, that is a sneaky little
It is. It's
trick they're doing there.
It's a sneaky little tactic, because I have patients ask me that all the time, and they're like, what's the difference between, going on the hospital's payment plan or just, paying off a credit card every month? And that is the difference, is that once you pay it off with the credit card, your account with the hospital is closed out and you lose your negotiating power there.
Wow.